Well, we're back right here in the studio, and I hope everyone out there is enjoying their evening. We have with us right now Theresa Fillatre, and she is a surveyor at Accreditation Canada. Theresa, welcome to our program, Hala, Kuwait.
Thank you, Tarek.
Nice to have you with us right here in the studio.
Yeah.
First off, could you please tell our audience about Accreditation Canada and what you're all about, please?
Yeah. Accreditation Canada is an organization that's not for profit, number one. It's 60 years old, and it also has another organization attached to it, which is the Health Standards Organization. And they work in 35 countries across the world to help healthcare organizations of all kinds, right down to community care, look at the standards and the processes for improvement.
And we'll be talking a little bit about that very shortly. And I know Accreditation Canada and yourself have been to Kuwait numerous times,
Yes.
Working with various health organizations here, the Ministry of Health and other health organizations. Can you elaborate a little bit more on that, please?
I can. I should tell you first, surveyors are considered peers.
Okay.
So most of us are physicians. I'm a nurse and a social worker, hospital administrator, retired.
All right.
But they're people that work in health systems.
So familiar with the field then?
Absolutely, and familiar with the issues. The issues in our systems are the same across the world. The context and the legislative requirements might be different.
Okay.
But the needs of people in terms of healthcare are the same.
Okay.
So the big thing with surveyors is that we come as peers. We're not employees of Accreditation Canada, but we've been trained in common standards that are used universally. And they're used in Canada, they're used here in Kuwait. So for instance, in 2007, Accreditation Canada began a relationship with the Ministry of Health here in Kuwait. And that resulted over time with the adoption of Canadian accreditation standards for public hospitals here in Kuwait. And that still exists today. And beyond that, it also included the development of people who work in the health system in Kuwait, doctors and nurses and so on, to become surveyors for your public hospital system here. So I was privileged as a surveyor to be able to be a part of that process in terms of helping to develop other surveyors and to come for 3 weeks to Kuwait and help them out on their journeys with first surveys of real hospitals in Kuwait and so on. So that relationship is very important to both sides.
Great to hear that. I mean, it's almost 15 years coming on and off a lot of different surveyors to the state of Kuwait.
You're really reminding me how old I am, and that 2007 was 15 years ago. Yeah.
Well, it's nice to have you once again right here in the state of Kuwait.
I love coming to Kuwait, and I love working
Excellent.
with people in the health system.
Excellent.
And I strive as a surveyor to keep on top of the changing landscape of standards. What the beauty of accreditation is for the public to know.
Tell us, please.
Is that the standards are universal for healthcare across the world. The standards are rooted in being client-centered. So the patient and the family, the community, is fundamental, because a hospital or a healthcare organization doesn't exist otherwise.
Without that.
Yeah, without that. The other fundamental premise of accreditation is that it's a journey of continuous improvement.
Right, right. So maybe you could tell our audience now a little bit about the different levels of Accreditation Canada and how that process works.
Yeah.
Because I know a lot of people in the public, they would be interested to know. They enter a lot of the different health organizations, hospitals and so forth, and they see a lot of the different banners and with different names. And so maybe elaborate a little bit more on that, please, that process.
So the public is very interested, I think, more and more each day, and I think the pandemic that we've all gone through in the world has really shone a light on the importance of quality and safety in healthcare. Things like infection control practices, hand hygiene, keeping our surfaces clean at home, same in the healthcare setting. So I don't think this is going to go away. I think it's just magnified the problem more. So when a person goes into a healthcare setting and they see the accreditation award on the wall or in the elevator or in the office, wherever it may be, they can be assured that that organization has done its ultimate to meet the standards. So part of that is using a quality framework and making sure that the processes for looking after people, that the patient has a voice in it, and that the work of healthcare comes together and wraps around the patient. That is fundamental to accreditation. So when I come in as a surveyor, I am taking a look at the standards that are fundamental to everyone and having dialogues. I'm not doing an inspection. I'm having dialogues with various people accountable for different parts of healthcare, because there's other things in the health system, like the importance of housekeeping services and nutrition services and that kind of thing.
They all work hand in hand.
They absolutely do.
So maybe you could also tell us now, I know...
you asked me about the levels.
Yes, tell us about that.
That's what and I forgot that I was answering that question.
Tell us about that, please.
So the levels are developmental. So you start out, if you meet a certain set of minimum standards, you may get an award of a gold level. And then you can move up with continuous improvement and more learning, because it's about being a learning system and organization. Then you can move up to platinum, and then ultimately to the diamond level, which is top notch.
All right.
Once you reach diamond, you're not safe.
You've got to keep the level high there, huh?
Yeah, we know that with quality, we got to keep our eye on the ball.
Sure.
So we urge patients to always ask questions.
Yeah.
We urge healthcare providers to always seek new knowledge, and administrators of systems to engage in accreditation. It's something that helps you grow. It's something that reinforces good value to people that are seeking healthcare. So organizations in Kuwait that are not accredited, I would encourage them to talk to their colleague hospitals and organizations and ask them what the journey's been like. How has it made a difference?
Well, I know you're here now with two other surveyors, I believe, at Dasman Diabetes Institute. So can you tell our audience a little bit about the journey of Dasman Diabetes Institute through the accreditation process, please?
I'm at Dasman doing some education sessions actually around quality, risk management, and things like how to use quality tools and that kind of thing. And then probably 4 years ago, I think it was 2018, when you had the big flood. I was privileged to be the team leader at Dasman and to lead a team of surveyors and engage in discussions with people in the organization and with patients and researchers and so on, and they were successful. So they developed a journey. That was their third survey, and they achieved the diamond level. So.
And how do you see Dasman Diabetes Institute after, this was 2018, and now
I cannot
how do you
believe
see the journey?
Difference, and I am honestly expressing how I feel as a human being, let alone as a surveyor. It is absolutely delightful to go in there and see the change. You can feel it when you go into the organization. You have happy workers, you have happy patients, and I've talked to many of them this week.
That's great.
I've talked to the board. It's a new board. It's revitalized. The leaders have led the organization through a major transformation in the last 4 years. So they rearranged clusters of research units specific to diabetes. This is important for the people in Kuwait because there is so much diabetes in your population. It's a major risk, and it's a population health issue, big time.
Yeah, Dasman Diabetes Institute, which is funded by the Kuwait Foundation for the Advancement of Sciences, is a reference center and a leading institute in the area for diabetes care and research also.
It's also funded by the Ministry of Health, and I think that's an important note as well. And they're very much engaged in the international research area, and they actually participate with an advisory body around scientific evidence and that kind of thing. In talking to patients today, it was apparent to me that it's truly making a life difference in the lives of people that have had diabetes and are insulin dependent and so on. They now have the skills through the DAPHNE program where they can adjust their insulin.
That's right.
Adjust their intake. It's important around things at time of fasting.
Yes.
Which happens here, and how they prepare for that. It was enlightening to me, but a very important piece of work. This woman talked about how she could not carry out her duties as a professional working elsewhere in Kuwait without this information. So Dosman is doing a great job, I think, in trying to have the best evidence-based approach to not only research, but how you take the findings of that research and actually change the practice.
Sure.
Whether it's people living in the country or around lifestyle, activity, eating, and so on.
Yeah, it's a multidisciplinary,
yeah.
function that's going on there. The medical sector, as you just said, with the DAPHNE program is an amazing program.
Yeah.
And the research is state-of-the-art research that's taking place there. The research team is really
it is a
into
center
doing
of
the best.
excellence. It is a center of excellence. You know, and I think it could use a lot more funding, but that's not my job here. Our job as surveyors is to go in and validate performance against the standards, and we make a recommendation to the accrediting body in Canada, and their committee sits down and it says, based on what we've evaluated and provided, they will issue an award.
Excellent.
And we pray that it is diamond.
Well, that's what everyone hopes for. I mean, Desman Diabetes Institute is a great institute right here in the state of Kuwait doing amazing work. And Theresa, it's a pleasure to have you with us right here on our program. Do you have any last words or comments for the audience watching the program this evening?
I would say to people that are looking for health care, if you have diabetes and so on, please seek the best evidence-based place to get your care. Ask questions of the system, because the system is accountable to you. It's being funded through KFAS, it's being funded through the Ministry of Health. So it's important that people have a voice and so on. For organizations that are sitting out there and watching this, who are in the healthcare business, talk to your peers and think about accreditation. It's a good thing for everyone, and it's beautiful.
Well, we'd like to thank you so much. I know you have a busy schedule. We appreciate your time with us this evening right here on Hala, Kuwait.
Thank you so much,
Thank you very much. We'd like to thank our distinguished guest, Theresa Fillatre, a surveyor at Accreditation Canada, for her time with us this evening right here on the program.